We are performing the sacral thigh thrust test, one of the special tests used to rule in a sacroiliac or SI dysfunction. Indications for the thigh thrust test include SI joint dysfunction and/or pain in the SI joint region. Contraindications include a hip pathology. Before performing the thigh thrust special test, screen the hip to rule out a hip pathology. The thigh thrust test psychometrics are as follows. According to Robinson et al. In 2007, the thigh thrust test has high reliability. Vanderwerf et al. In 2000 reported a sensitivity of 80% and a specificity of 100%. According to Dutton, the thigh thrust test is one of the few SI joint tests with fair sensitivity. This slide is a summary of the testing procedure that will be demonstrated in a mock interaction. Here we have a summary of the patient position, therapist position, stabilization, direction of force, and mobilization in the thigh thrust test. A positive sign is when a patient reports that the thigh thrust test reproduced their symptoms. A positive test indicates inflammation in the area. Here is a demonstration of a mock interaction.
The therapist can stand on the same side or opposite to the side being tested. We will perform the test by standing on the side opposite to the side being tested, the right side. Have the patient scoot towards you. Roll the patient towards you and place your hand on the sacrum. Roll them back into a supine position and with your other hand, flex the hip farthest away from you to 90 degrees with neutral hip abduction and the knee relaxed. Apply a vertical force through the long axis of the femur. Ask the patient if that reproduced their symptoms. Compare bilaterally.
The following is an example interaction with a patient who complains of left buttock pain.
Hi Carrie, my name is Katie Lamb. I'm going to be your physical therapist
Hi,
today.
Katie.
I hear you're having some pain in your kind of low back buttock area. Okay, and that's on the left side.
Yeah.
Okay, so I'm going to just do a couple a test to figure out kind of where that pain is coming from and maybe what is causing it. So I'm going to start with what is called a thigh thrust test. So I'm going to have you go ahead and lay down. And I'm going to do it on your right side first just so you get an idea of what it feels like.
Sure.
So what I'm going to do, I'm going to have you in a second roll towards me. And I'm going to place my hand kind of on the low of your back, kind of right here on your sacrum.
Okay.
And then I'm going to bring your hip up, and you're just going to kind of relax your knee. And I'm going to press down on your knee like this. And you're just going to let me know how that feels.
Sure.
Okay. So go ahead and roll towards me. I'm going to place my hand. Good. Bring your knee here. And I'm going to push down. Okay. And then bring your knee down and relax. Did that reproduce any of your symptoms?
No.
Okay, great. Now what I'm going to do is I'm going to go ahead and test this side and do the exact same thing.
Sure.
Okay. Okay, so now go ahead and roll this way towards me. I'm going to place my hands underneath your sacrum. And go ahead and bring your hip up. Good. And I'm going to go ahead and press down here. Okay, good. And relax. And did that reproduce any of the symptoms you've been having?
Yeah.
It did. Okay, so since you did have reproduction of symptoms on when I did it on your left side, that does indicate a positive thigh thrust test. So that can lead us to think that you may have some problems with your SI joint. So we're going to do a couple other tests just to be sure, and that way we'll be able to make sure that we know where your pain is coming from. Okay.
So much lotion. Okay.
Hi Carrie, my name is Katie Lamb. I'm going to be your physical therapist today. Position, and with your other hand, flex the hip farthest away from you to 90 degrees.